Hello, everyone. Welcome to day 2 of the Preemie Health Talks. If this is your second session of the day, welcome back. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Preemie Health Talks is the first international live series that CPBF is hosting in 2021. These educational sessions are in collaboration with the Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, the Canadian Neonatal Network, and the European Foundation for the Care of the Newborn Infants, EFCNI, and GLANS, the Global Alliance for Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to empower families of premature babies every step of the way through support and education. We believe that through consistent information, access to helpful resources, and peer support inside and outside an ICU, we can empower families, ensuring they are ready to care for their babies. For these Preemie Health Talks, we brought health experts from around the world and from all over Canada. We'll be diving deep into topics affecting preemie health, from breastfeeding to parental mental health during the pandemic, from the importance of kangaroo care to the best practices to protect your baby's skin. If you need closed captioning, you can watch it live from our YouTube YouTube channel and enable closed captioning on the screen. I want to thank our sponsor Medela, Water Wipes, and Prolacta Bioscience for the ongoing support. And please, you can interact with our speakers by sending your questions, your perceptions, perspectives, and stories on the comments area below your screen. And right now, we are going to have the team, the breastfeeding team from Sick Children's Hospital, right here, joining us live from Toronto. And we're going to talk about support breastfeeding and the provision of breast milk at SickKids Hospital during a pandemic. From the hospitalized infant providing breast milk and for breastfeeding during a pandemic can create unique challenges for parents. The SickKids breastfeeding team describes how they have adapted their care for the parent-infant during this time in order to safely provide and coordinate the provision of breast milk for this vulnerable population. And joining here is Jacqueline Erasmi. Maybe you can wave so you can see who you are behind the mask. She's been a registered nurse for 20 years. Her primary focus has been in maternal child health, having worked in all areas, including antenatal, postpartum, and an ICU. She's currently a member of the breastfeeding program at SickKids, working as an international board-certified lactation consultant. Jacqueline, welcome. Thank you for joining us.
Thank you.
I also have Samantha Sullivan, who is a registered nurse and international board-certified lactation consultant with varied experience. She has worked at SickKids for almost 20 years and is a member of the breastfeeding program, providing support to families in the ICU and throughout the hospital. Thank you, Samantha, for joining us. And last but not least, Laura McLean is a registered nurse and international board-certified lactation consultant, currently working as a member of the breastfeeding program at SickKids. In addition, she has been a guest lecturer at the University of Toronto for the last 5 years, teaching nursing students about infant feeding and nutrition. Thank you, all of you, for joining our audience today. We have an international audience of people joining from all over the world in Canada. So thank you so much for being here and sharing your expertise and experience with us.
Thanks for having us.
Thank you.
So I know we have a presentation and everybody can send comments we're going to address at the end of the presentation. So I'm going to share the screen here. There you go. And we are good to go.
Yep. So you're going to see us shuffling around a little bit here. Hi, everyone. Thank you, Fabiana, for inviting us to present today. I'm just going to take my mask off. Our presentation, Supporting Breastfeeding, the Provision of Breast Milk at SickKids During a Pandemic. We're going to break our presentation into 3 parts. We're going to talk to you about our usual approach to lactation. That's my piece. And then how COVID has impacted our care and the strategies we put in place to address the challenges. Next slide, please, Fabiana. So who needs breastfeeding support? At SickKids, we're not a birthing hospital. However, we feel that everybody at SickKids needs breastfeeding support due to the unique challenges of their hospitalization. Next slide, please. So we have a proactive approach, and since 2018 in January, our lactation support resources were increased to allow for a full-time position in our NICU. This increase has allowed us to have a prophylactic approach to the lactation care that we provide to all NICU families. And we currently service and have the capacity for 41 beds in our NICU. Every baby admitted to NICU will have an automatic referral for an LC consult. The order is placed by the physician as part of the admission order set, and will come through to us on our electronic charting. Our goal is to connect with the mum within 24 hours of admission. Ideally, we want to see the mum in person, but if this is not possible, we will try to connect with the mum by phone and ask her for her email so that we're able to follow up and send her a link to our breastfeeding program website and further personalized information as needed. If the mum is not able to come into the hospital and we're unable to get hold of her by phone, which sometimes is the case when mums are still admitted to hospital, we'll try to connect with her partner or alternate caregiver to provide them with the basic information they need so that they're able then to pass it on to the mum. And if the mum is still an inpatient at the birth hospital, we'll quite often contact them and speak to the nurse or the LC working at that hospital to help advocate for her to get the help and support she needs and make sure that she has every, pumping equipment and whatever else she might need. Sometimes mums are referred to us prenatally by the higher risk pregnancy cardiac and surgical clinics within our hospital or at Mount Sinai. We have an agreement with them. And this initiative was started by our dietitians in collaboration with us here because we were noticing that a lot of first feeds were donor milk. And we really want to advocate that first feeds should be breast milk, and we will wait a couple of days for the provision of breast milk and then start donor milk. But this initiative has helped us increase first feeds to be breast milk and colostrum. And so this high-risk population is getting early prenatal lactation care. We provide them with breast pumping kits that they're able to take to the birth hospital over at Mount Sinai. And with our breastfeeding resources booklet, we can able to go through everything sort of thoroughly with them so that they have everything they need and they're prepared before the delivery to start pumping as soon as baby is born and that baby has been whisked over to us at SickKids. Where are we? Next slide, please. And so you can see our poster, The Pathway to Breastfeeding. And we have this poster up in all of our pumping rooms. Our LC team developed this with our graphics department here within the hospital. And we developed it to help guide families through their breastfeeding journey. So we can just briefly go through each step. And starting early is key to lactation success. As mentioned before in our proactive approach, we really want to see mums as soon after admission here as possible, ideally within the first 24 hours. We're having babies admitted immediately after birth and some later on due to complex medical and surgical conditions. Some mums will have received some lactation support at the birth hospital, but we meet many mums who haven't had any care and support provided. Next step on our pathway is pumping, and we want to pump with the mother to provide the best service. So a full consult will include the provision of breast pump kits. So we supply all the equipment that they need. So we're able to pump immediately with the family. We give them storage basins to keep their kits and all their extra equipment and to clean their kits, and a breastfeeding resources booklet that they're able to refer to during the consult and at a later time. We'll show the mums the pumping rooms where they can get their breast milk bottles and the cleaning station. Most of our consults will take place in the pumping room, and that enables us to, have the privacy needed with the mum so that they feel more confident asking questions. And during this time, we're able to do a full health assessment of the mum and watch her pumping so we can assess for flange size and overall parental comfort. We're very lucky to have some extra resources within the hospital. So if a mum does need a different size flange, we have access to those. And if we have them, we'll supply them to her because we've met a lot of families or mums who do have pain with pumping because they're using the wrong flange size. So that's a quick fix that we're able to help them with. We give them our breastfeeding resources booklet, as said previously, and that booklet will go through step by step. In case they forget anything, they can refer to it, and we highlight there that we have a module of videos that they can refer to and look at in their own time. And in usual pre-COVID times, we would normally take the parent support person, their dad or their parent, to the pumping room with them so that they have that extra support and an extra pair of, ears and eyes that they can refer to when they get home. But unfortunately, we're not able to do that right now, so the mums are on their own. Our LC team, we also manage a loaner pump program. And we've been very lucky to have funding from our foundation for that, and from the previous pump for preemies, which was disbanded. We acquired some pumps through them. So we currently have 70 pumps within our loaner program, and they're all in high demand. So the pumps are as fast as they're coming in the door from one family, they're getting cleaned and going out to another family. Okay, our next step on our pathway is oral immune therapy. And we want to start this as soon as possible. And during our time in the pumping rooms, we'll talk to mum about the benefits of providing oral immune therapy. We want to encourage her to be active in this care and support the many benefits that it provides. So we want to make sure that we're helping to prevent infection and harmful inflammation by providing OIT, the oral immune therapy, and any colostrum or breast milk that we are able to collect with the mum at this initial consult, we'll take straight to the bedside so that the nurse can teach mum how to do the oral immune therapy right there and then. And then it's something that she can continue doing when she comes in to visit her baby. The next step on our pathway is kangaroo care, skin to skin time, which is encouraged as soon as possible. And if parents aren't able to hold their baby on their chest, we want to encourage modified forms of holding and therapeutic touch. And we have a video that parents can refer to that show them different ways that they're able to have this bonding experience with their baby. Then we move on to non-nutritive suck-in, NNS. And this is for infants that are stable with handling, at least 32 weeks, and have periods of awake and alert time. We want to provide the opportunity for babies to do NNS, as this is a sort of natural progression from kangaroo holding and an opportunity for mums to feel confident positioning and holding their baby, getting ready for the baby to latch. The baby also has an opportunity to smell, like lick and sniff at the breast without the stress of having to feed. This is the first stages, of breastfeeding. And we know that mums that are able to provide this opportunity for NNS, they tend to have longer breastfeeding duration. And then our last step on our pathway is breastfeeding. And not all of our babies will get to this step while they're here with us as SickKids, because many of them are getting discharged or transferred to a level 2 NICU. However, when baby is ready to take oral feeds, and if mum wants to breastfeed, we really want first feeds to be at breast and support that. So thank you for listening to me. I'm going to pass over to Laura. And Laura is going to talk about how COVID has impacted our care here. Thank you.
Thank you, Samantha. So sorry, I'm just trying to bring up my section. So a new study published in April in the Journal of Pediatrics supports existing evidence from the WHO and the CDC that breastfeeding is not contraindicated if mom or baby have suspected or confirmed COVID-19. Breast milk is not a likely source of infection. When we have a confirmed or suspected case of COVID-19 or in mother or baby, special precautions are needed. The parent should wash their hands before and after breastfeeding or pumping breast milk. They need to wear a mask while breastfeeding or pumping. They need to sanitize all the pumping equipment before each use. And the infected person is considered a close contact and both need to quarantine. Next slide, please. If the parent or baby has had close contact with a COVID-19 infected person, but has no symptoms, only the one who had the close contact needs to quarantine. For example, if the parent had close contact with a positive case, but has no symptoms, the parent needs to be quarantined, but the baby does not. The parent should follow the precautions on the last slide. When these situations have come up at SickKids, the parent is escorted in and out of the building to visit the baby in an isolation room. They are not allowed to use any communal areas. We would monitor the baby for symptoms and quarantine if any develop. If both in the dyad have COVID-19, then no precautions are necessary while breastfeeding or pumping. The bottom line is the breastfeeding parent and baby should never be forced to separate unless the parent is too unwell to care for the baby. Next slide, please. In this WHO statement, it says mothers and infants should be enabled to remain together, practice skin-to-skin contact, kangaroo mother care, and rooming in day and night, especially during the establishment of breastfeeding. If the newborn is admitted in the neonatal unit, mothers should be supported to express breast milk and arrangements should be made for them to have free access to the unit. Appropriate IPC measures should be applied, such as wearing a mask and practice respiratory and hand hygiene. Next slide, please. COVID is an added stressor to an already stressful situation. The effect on parental mental health has the potential to impact the whole breastfeeding pathway. Reduced parental presence has made it challenging for our team to connect with moms in person. Visiting restrictions, which only allow one parent into the building at a time, has had an impact on the pathway and support we can provide. Parents are unable to support each other while in the hospital. This is even more impactful in the first few days after birth or admission, when parents are receiving updates about their baby's condition. Families report that visits are more stressful and parents feel alone. For example, one mom told us a story of the emotional experience of when her baby was opening their eyes for the first time, and she had to show dad over FaceTime while he was crying in a nearby park. Moms are not here for early teaching, which impacts our key message of starting early with pumping and hand expression. Mom's limited mobility in the first few days postpartum has become even more challenging as they don't have their partner with them for help and support. We once had a mom who needed a loaner pump but was doing kangaroo care. The rules stated mom needed to leave the building so that dad could pick up the pump. We had to advocate to change this rule in these situations so that they did not come up again. Usually our consults would be with both parents, which increases their understanding of the information, as Samantha mentioned, and encourages the partner to be supportive. But unfortunately, right now, we can't do that. When partners want to visit their baby, moms are now having to wait in the car or outside. This is reducing our opportunities to meet with the moms because they have to leave the building and they delay pumping. Some moms are finding it too painful to wait in the car, so they're not coming to visit at all until many days after the birth, especially mothers who've had a cesarean section or traumatic birth. When the parent or baby has suspected COVID-19, or if the baby is positive, the parent visiting or staying is unable to leave the room for food or to clean their pump kits. Moms have to be encouraged to take care of themselves, as some are not eating or drinking as they should. The visiting restrictions are also impacting the provision of oral immune therapy, kangaroo care, non-nutritive sucking, and breastfeeding, as moms just aren't as present because they have to switch off with their partners. Parents are less able to be present at the bedside since children are at home and not in daycare or at school right now. They no longer have the support of family and friends to help with childcare, and currently our play park where siblings could be cared for is closed. Enhanced screening makes it harder for parents to visit. Usual minor ailments are now taken very seriously with strict criteria for entry to the hospital. A headache, which we wouldn't think much of before, is now a COVID flag, which will mean the parent cannot visit. Parents' ability to visit has also been affected by access to accommodation for those parents from out of area. Parents that qualify for a room at the Ronald McDonald House have been impacted, as it was closed for a few months at the beginning, and it's now open to families, but they have reduced capacity and increased wait times. Parents need a COVID test and clearance prior to being accepted. We have a lot of parents from far away that are in need of a room at Ronald McDonald House. Parents of hospitalized babies already struggle with stress interfering with lactation hormones and their ability to establish their milk supply, and the pandemic exacerbates this. Stress and anxiety can cause interference with the milk ejection reflex and pumping frequency. These can reduce the milk supply. Jackie's now going to talk to you about some of the strategies we've put in place to deal with these challenges.
Hello. Okay, so now that we have discussed all the challenges that COVID-19 has caused, our team has implemented some strategies and adapted our care to help support parents during their hospital stay. So it starts on admission. So we communicate regularly with the bedside nurse and unit clerks within 24 hours of admission. Because our team is not just unit specific, we cover the entire hospital. Sometimes it's really difficult to connect with these parents, especially since there's a lot of restrictions right now. So we always get the bedside nurse or the clerks to usually page us or call us so that we can meet with the parents ASAP. When moms are coming in, they're really struggling with mobility, like Laura said, just because they've had a stressful delivery or they've had a C-section. So when time permits, we're really helping these parents have access to all the things that they need for pumping. So we take them down to the specialty food shop, which is on the main floor, for them to get the pumping equipment that they need, or say different flange sizes or nipple shields. We really need to advocate for these parents to enter the hospital when need be, especially when Laura said that sometimes it's restricted because there's already one parent that's already visiting. So sometimes these restrictions need to be adapted or changed in certain circumstances. We're also finding that more families are in need of social work just because they have more emotional and say financial needs right now, since it can be very isolating for these parents. So we tend to be working very closely, as we always do with social work, but we tend to be putting in more consults for them. And although the detection of COVID-19 in breast milk has not been reported to date, and the risk of transmission for babies is very low, at SickKids, we still need to educate parents on how to safely provide breast milk for their babies while in the hospital. So the infection control has put together guidelines for collection, handling, and transportation of breast milk for all moms and babies that have confirmed or suspected COVID-19. And most hospitals will have their own kind of protocols and guidelines. And like Laura mentioned earlier, some parents are unable to use communal spaces for, say, the dishwasher or for pumping. So we, the LCs or the RNs, the bedside nurses, or say service assistants will help the mom by taking their breast pump kits to the dishwasher for them if they're not able to access it. And throughout the entire pandemic, we have continued to educate the healthcare team in terms of keeping the breastfeeding diet together, since it's very, very important, and that's like the best protection for them, because the research is always evolving and changing based on for the beginning of COVID, we didn't really know a whole lot about it, but we tend to keep up to date and make sure that the healthcare team is aware of the current standards. And when parents are unable to visit during quarantine, we send equipment. So we've had to get really creative sometimes and use resources that we haven't done before. So we've even mailed our parents the equipment that's needed to pump. So the breast pump, or sorry, the collection, the milk collection bottles, we've actually mailed it to them by a mail courier, which we've kind of never done before. Next slide, please. And because we know that most community postpartum supports have gone virtual nowadays, and because of this, SickKids has definitely seen an increase in hospital admissions due to, say, weight loss, jaundice, or feeding problems, especially in the newborn. So due to the lack of community supports right now, when possible, we're able to advocate for delayed discharge to save moms really struggling with breastfeeding and needs more specialized breastfeeding support. We'll push for a delayed discharge so we can give her the help that's needed. We also make requests, say if we feel that they're not ready to go home, we will definitely push for, like I said, delayed discharge, but also do have them come back to SickKids for a follow-up visit, as well as we're making definitely more phone calls nowadays and connecting with them if we can't see them in person. And we definitely will always look up the community resources that's in their area prior to discharge. And next slide. So here we just have our website. So we have a great, we actually just updated it. We have a great website that's a great resource for parents to use that has about kids' health documents. It has a lot of good information, and it has links to our educational videos for our parents. So we will usually actually send this link via email or tell it over the phone so they can access all the information there. And I think that's all we have. Thank you for listening. Thanks, Fabiana.
Thank you so much, Jacqueline, Samantha, and Laura, for this great presentation to share with us your experience and what is happening with breastfeeding during the pandemic. I think my first question is, with all these restrictions in place, still in place, what have you noticed of the last year with breastfeeding rates in your unit?
Sorry. I think it comes back to the visiting restrictions. So I don't have numbers per se, but it's definitely been definitely a challenge just getting the parents here and getting the mom here during the feeding times. It takes a lot more coordination to plan those things. So, but I would say it's definitely been a big challenge because they're not here for feeding times.
Right. I think my other question is because obviously your babies are not born at SickKids, and I think we touched base on that before. So how do you contact the families as soon as they give birth to make sure mom starts to pump and produce milk or the colostrum or liquid gold to supply for the babies that the baby got transferred, but mom is still admitted in another hospital?
Yeah, we try to connect with them within 24 hours, sometimes even sooner. We're hoping that the birth hospitals will initiate that, but it's not always the case, unfortunately. So we try to connect with them usually by phone within 24 hours of admission here at SickKids. And we'll keep trying every day until we can get contact with them. And like I said earlier, we try to contact with the bedside nurse. So in case we're not able to contact them by phone, if they do happen to visit the bedside nurse will always call us in so we can give her the help.
And for families who live remotely and either coming to SickKids and to stay in Toronto where they don't have, all the supports are kind of closed right now. There's restrictions at Ronald McDonald's, as you mentioned. A lot of families cannot afford to stay in a hotel. So how is the support from the lactation consultant point of view for those families who are alone in the city, remotely, with no extra support?
I think we try to make sure that they have all the access to the equipment that they need. We try to make sure that they have all of the teaching that they need. If we think that they need it, we'll connect them with social work. If they require additional support, like our team in general, like not the lactation team, but the medical team in general is really good at noticing when a family is struggling and may need extra support and calling in social work to help with any other resources that could help them while they're here in the city and may not have access to very much.
Well, I think this is so important because there's so many families that come from different cities, from the northern Ontario to SickKids, but also we know a lot of families get transferred to another province when they live closer to another province than coming to the city. But I think a social worker is available in almost every hospital in Canada, and I think families can certainly go for that support because it's so important, especially during this time. So thank you for doing that. I think my next question is for families when they are ready to get transferred to their local hospitals or going home. A lot of families have pointed out to us that they don't have the same support anymore because of COVID, and a lot of things became remotely. So how are you providing that remote support for those families?
We try to advocate to get them the care that they need while they're with us. If the baby is ready to start to breastfeed, for instance, we'll try to make sure that we at least get 1 or 2 feeds in with her before she's transferred, especially if we know that the support isn't going to be at the referring hospital. Again, we direct them to the website because the videos there are pretty comprehensive that they can watch. And if they've had some hands-on care, then at least they've had, some basic support. And really emphasizing, with our mums, this, establishing their milk supply. Yes. Getting started early, establishing the milk supply so all their options are open to them.
Yes, and we share the link for the website. There's so many great resources there for families. And we all know how important breast milk is. And so we always obviously going to advocate for breastfeeding because we know how important it is for babies who are born preterm or sick babies. And we just heard from Dr. Cheryl Unger before your session today, and she was talking how amazing it is that the breast milk has the the antibodies to fight COVID-19, even moms were positive. So it's so many benefits for babies. And I think we have to continue to advocate for breast milk. So I'm very grateful that you join us here today. Any final thoughts for families and healthcare professionals listening to us today?
For families, I think reach out for supports in the hospital where you are. So ask for help. Don't be afraid. Generally, people want to help you, and no question is too silly. So ask lots of questions. Be active in your baby's care. And for healthcare professionals, again, if you need more experience, reach out to colleagues who can maybe help you get more experience. Or if you're not sure about a question, same as we would, we would reach out to other colleagues in the hospital if we were needing support ourselves with answering a question.
Absolutely. So thank you so much, all of you, Jacqueline, Samantha, and Laura. Thank you so much for joining us here today.
Thank you for having us.
Yeah, thank you, Fabiana.
And for all of you watching us live on Facebook, on our YouTube channel, thank you for joining us today. And if you missed a talk, you can watch the recordings on our YouTube channel and also on our website from next week. I want to thank our sponsors, Medela Water Wipes and Prolacta Bioscience for their ongoing support. CPBF is a registered charity, and 100% of all donations received this week will go to our support programs for families. To donate, please go to CanadianPremies.org. The website is right here. And we do believe that together we can create a brighter future for all premature babies and their families. And tomorrow, 1 p.m. Eastern Time, is going to be our day 3 of the Preemie Health Talks. I'm going to have Dr. Johanna Constanzer joining us from Germany. She's going to talk about the global impact of COVID-19 on neonatal care, but a parent's perspective. And also Dr. Pablo Duran, who's going to talk about breastfeeding, early nutrition, and the impact on the life course. So thank you, stay well, and I see you tomorrow.